So another abnormality, or the first abnormality of this photo, would be that the labium superioris oris, which is the superior part of this child's mouth, did not fully develop. This is another term for this right here would be cleft palate, or cleft lip, I'm sorry. Cleft lip. Cleft palate would be if the velum or hard palate had some sort of hole or different sort of crack or developmental issue with that. Sorry, that's how I could correct myself. But since this is with the labium superioris oris, this is cleft lip. And that is where the lip has not closed in with the development, and that would be the reason for this cleft lip. Another abnormality with this photo would be the nasal concha, and you can tell that the labium superioris oris, which lacked in development, it had to have affected the nasal concha because it is connected, and it is slightly crooked, so it had to have affected it in development, whether it had been the bone is slightly crooked, or maybe it is just grown that way, but it's sort of inferred, but the nasal concha had to have been affected, I'm assuming. Another So more abnormality would be the maxilla. And the reason for this is the maxilla is the whole superior jaw per se. The maxilla is that itself. Not the mandible. The mandible would be the inferior jaw itself. But the maxilla is the superior jaw. And as you can see, this takes a whole chunk out of it, and so that has to be abnormal, and that would be part of this cleft lip. This is prominent, and it's on this little one's right side, so it is very clear that this is an abnormality, and with most cleft lip, it will be affecting the maxilla because of the fact that it is taking part of the lip, or the labium superioris oris, my bad, and moving it up and taking a bigger gap out of the maxilla because of their development. And that would be the reason that the maxilla is involved. So one more abnormality would be that now for some normal features, or I should really have named this not affected features, or something like that. But the mandible is not affected by this. This is the inferior part of the jaw. This cleft lip is really focusing in on the superior part of the jaw or maxilla. It's really not looking at the mandible whatsoever. The labium inferior oris, which is this inferior portion down here of the jaw or mandible, it's really just down here, and there's nothing wrong with it. The zygomatic bone, that isn't being affected at all on either side, except, I mean, maybe there's a cut under this Band-Aid, but there's nothing wrong with the cleft lip. The alveolar process, which is down here, it's on the labium inferioris, under there in the gum area, and that also is not being affected. The coronoid process is also not being affected, and neither is the ramus. Those are near the same area. Over here, you can kind of tell by this Band-Aid that would be in the area of these two process in the ramus. But none of these are being affected. This is all in the medial area here. All of this is pretty much going to, this cleft lip will be affecting this little kid's speech, because it is a big area and it's going to be affecting his or her speech as they are growing, but it is not something that is too hard to fix. Can be fixed with a pretty simple surgery. However, it will leave a lasting battle. But if you look into Operation Smile, things like that, you can actually learn a lot about this, and it is pretty cool. So that is all I have to say about this, but it's pretty nice to look into, and hope that cleared everything up.